All right, I'm back again. And now we want to look at the trematodes, which are the flukes. So these trematodes, as we were told when we did parasitology, that they are grouped according to the habitats, that is where they are found. And of course, we have the blood trematodes, that is the blood flukes. And then we have schistosoma hematobium, the only schistosome that you can find in urine. So we also have Schistosoma mansoni, Schistosoma japonicum. These are the blood trematodes. They will have hepatic trematodes, that is, they're related to liver, and they are Fasciola hepatica, Clonochis sinensis, and then we have a lung trematodes, and the common one there is Paragonimus westermanni, the only trematodes that you can identify through sputum. Then we have intestinal trematodes. Of course, this is where we have the highest or the largest size trematodes, which we know as Fasciola buschii. Fasciola buschii got its name from the person that identified it, Pfaffer 1843. Scientists by the man called Busk, from someone who died in London of parasitic infection. So we also have and it's actually seen in small intestine. We also have the ones that are seen in large intestine. So these are how the trematodes are categorized according to where they are found. According to where they are found. And of course, we may not be able to run through it fast, but we can actually summarize it by looking at some simple questions that will remind you of those things that you did while in class, of course. And one of such questions is, which of the parasite sexes that which of the parasite that is in the group of trematodes that have their sexes separated, and the only group there is Schistosoma hematobium. Schistosoma hematobium. Then you remember that we also talk about the diagnostic stages, what we see when we are trying to diagnose these parasites. And then if we ask the X, the trematode that has their X pass in urine when there is infection, of course, it's no other than Schistosoma hematobium. Schistosoma hematobium. Then the one that their X are passed in sputum is Paragonimus westermanni, of course. Paragonimus westermanni. Then most of them are liver fluke. Then, but Fasciola hepatica is seen in liver, of course. That was the common name is chip liver fluke, so it's a fake chip. Then Clonochis sinensis is also a oriental liver chip. Oriental liver fluke. Then Opisthochis felineus is also associated with liver, is a liver fluke. But Fasciolopsis buschii is not a liver fluke, it's an intestinal fluke. It's an intestinal fluke. Then, and this Fasciolopsis buschii is the largest trematode. Largest trematode, yes, largest trematode. Now, if you are asked, you remember that condition called Katayama fever. You remember it? Yes. Katayama fever is produced when one is infected with Schistosoma japonicum. Japonicum, yes. Then, and when you have a case of carcinoma of urinary bladder, where is it associated? Urinary bladder. Remember that we have a trematode that is associated with urine, okay, and that is Schistosoma hematobium. So if you ask which of the trematode is associated with carcinoma of urinary bladder, is no other one than Schistosoma hematobium. Schistosoma hematobium. Then chip liver fluke is common name for what? I just mentioned it. That is Fasciola hepatica. Fasciola hepatica. Then Chinese liver fluke is common name for what? Clonochis sinensis. Clonochis sinensis. Now, this Clonochis sinensis has their bile duct, okay? It has carcinoma of bile duct. So when you see which of the trematode has bile duct carcinoma that is associated with it, is no other trematode than Clonochis sinensis. Then we also have the parasite that is not transmitted by eating raw or undercooked fish. Okay, yeah, Clostridium sinensis, you can get it from eating raw or undercooked fish. The same thing with the Diphlebotomy latum, of course, is a fish tapeworm. The same thing is also Paragonimus westermannis, because fish is an intermediate host. But you see Schistosoma japonicum, the is only when you eat mollusk, a type of snail that is contaminated, that you can get it. All right. Then, if you ask the infective stage of this Schistosoma hematobium is what? Yes, diagnostic stage is egg, of course, but the infective stage is what we call Cercaria. So these are common things we need to remember generally about the trematose. Now, we look at the largest group of the roundworm, which we call nematodes, and we may not be able to go through it generally, but we can actually summarize them using some questions. Yes, we can use some questions to refresh our memory about the nematodes. But before we go there, nematodes, just as the trematodes were divided based on the habitats, nematodes, which are commonly called roundworms, are also divided or categorized based on their habitats, where we see the adult worms. So we have the ones that are found in small intestines, and we have parasites like Ascaris lumbricoides, Salestoma duodenale, Necator americanus, and Strongylosis stachyloraris, and T. spiralis. These are the nematodes that we can find in small intestine. That's the adult worm. We equally have the one that we can see the adult worm present in the large intestine, and they are the Enterobus vermicularis and the TT, which is Trichuris trichiuria. Yes, they are found in large intestine. The adult form are found in large intestine. We also have the ones that are found in lymphatic system. Okay, that is tissues. And the good examples are Ucherera bancrofti and the Brugia malai. They also have the one found in subcutaneous tissues like Lualua that affect the eyes, then Onchocerca volvulus, and the Dracunculus medinensis, which is the largest of this group. We also have the one that affect the body cavity, that is such as Mansonella pestans and Mansonella ozadi. Okay, so these are how the nematodes are generally classified based on the habitats where you can find the adult worm. Now, to touch the remaining parts, it's important we also look at some small questions that we can use to remember, because we can't go around. It's actually large. So, and as I mentioned earlier, the largest nematode parasite is what? Dracunculus medinensis. And remember that nematodes, they are also divided based on the one that lay eggs, the one that that don't lay eggs, but they give birth through larva. Then the one that has the larva containing eggs, that's actually the way they are divided. So you better go and look at it and find out those ones. Now, which of the nematodes lay eggs that are unsegmented? Of course, there we have Ascaris, I just mentioned it. We also have Trichuris trichiuria. But the ones that are segmented, we have Necator americanus, we have Strongyloides stachyloraris, we have Trichinella spiralis. Then, which one lay eggs that contain larvae? It's just one, and that is Enterobus vermicularis. It lays eggs containing larvae. Yes, it lays eggs containing larvae. Then, which is the best site where you can take biopsy for diagnosis of trichinellosis? It is the best site is deltoid muscle. All right. Then, another simple questions that you may need to think and remember is, okay, what are the characteristics possessed by fertilized egg of Ascaris lumbricoides which differentiate them from unfertilized form? So the unique characteristic that differentiates fertilized egg of Ascaris lumbricoides from unfertilized one is that it possesses clear crescentic space, yeah, at the pole. When you draw it, I think I will find time and the create atlas. For those of you that will major in medical micro in your final year, I think you will enjoy it. I will find time and create atlas for that. Then the life cycle of larva of Wucherera bancrofti in mosquito is what? We describe it as being cyclodevelopmental. Cyclodevelopmental. Then there is also, we were told that Lualua has a diurnal periodicity, meaning is present both during the day and during the night. So the larva is diurnal, it has a diurnal periodicity. All right. Then another thing that I think we need to also remember is the microfilaria that can be diagnosed in peripheral blood film examination is actually microfilaria of streptococcus. Streptococcus, yeah, streptococcus, sorry. The river blindness is common name given to which one? Onchocerca volvulus. River blindness, Onchocerca volvulus. Then we've been hearing, when we during our year 3, we heard about Calabar swelling. Which parasite is associated with Calabar swelling? Lualhuasis. Yes, Lualhua associated with Calabar swelling. Then we also talk about Mazzoti test. Mazzoti test is a provocation test for Onchocerca volvulus, if you still remember. So it's a provocative test. Then we have parasite that cause iron deficiency anemia. We have Ancylostoma duodenale, we have Trichuris trichuria, we also have Necato americanus. They can cause iron deficiency anemia. All right. Then the stage of Ancylostoma duodenale that is infective to human beings is what? Filariform larvae. Remember, it has different stages. We have Rhapticiform larvae, Filariform larvae, but the one that is infective to human is Filariform larvae. Filariform larvae. Then, is there any other thing that we think we need to remember concerning nematode? I think basically if we were able to remember these ones, then you're not doing bad. I must say that you tried. So with that, we can see that we've covered helminths. We've just summarized helminths, okay? So I just pray I find time so that we can summarize protozoa together. Thank you and bye for now.